All right, inhabitants of Edo State, Nigerians at large, you're welcome to yet another episode of the Matters Arising podcast, the movement for the peaceful Edo. So, right now we have wonderful persons in the studio here, and we want to do justice to a particular, should I call it a topic? Let me just call it. We want to have a conversation. Actually, I have my co-host right here with me, and she's going to tell you a name.
Hi viewers, I'm Cynthia. So we're going. Welcome to the show.
All right, Cynthia, it's nice to have you. That's how you sit down. I'm gonna be open people past me, whereas I'm taller than you, bigger than you. So it is all good. And on this show today, we want to discuss something that is pressing. And what is this? It is this pandemic that we hear everywhere. They said it is diphtheria. When I was in Oral English in school, I know diphtheria, something. Yeah. So we have heard that diphtheria fever is caused by Corynebacterium diphtheriae. So this particular bacterium, I think it has done a lot. We need to undo this case once and for all. And I think the only way we can undo it best is when we expose the nuances around its activity. And if everyone is conscientized and aware of what this is, how it is being experienced by people and the symptoms, and how to prevent it, I'm very sure we're going to lead in a healthier space here in Edo State. So we have brought two wonderful health personalities in our midst in the show today. And I have with me Asama Omataye, and she is a public health advocate.
Hello, inhabitants of Edo State. According to Ecosim, my name is Omasaye Asema. I'm a public health advocate.
All right, public health advocates. Yeah, you're welcome to the show. And if not be say the pharmacy work one study, say I not study that thing. By now, God. Well, we have another great medical practitioner in our midst too. And he has been a very good friend for a very long time now. And I have seen his contribution in the health space of Edo State. And I think he is worthy of attention right now. And we have here Jefferson Osaheni, and he is a registered nurse. Imagine having a prospective doctor as a female and a nurse as a male.
And I'm so glad that I'm here today. Thank you.
All right. If you have not seen a fine nurse, a fine male nurse, this is one, yeah? So, we want to have a conversation. This is not a conventional, it's not a traditional on-air discourse. It is a conversation. We just want to have people understand what is happening. So my first concern is what they saw. What is happening? I saw different posts online, people crying over the pandemic, the diphtheria fever. So we should now know the symptoms and some ways we should prevent these things and all of that. So please, we just want to hear you all talk to us, and then so that we can be better protected.
All right. First, I think first of all, the people needs to be aware of what diphtheria is. I'd like to talk about the awareness. Let's create this awareness first. Let's make the people understand these symptoms. This common thing with Nigerians that when you have cough, and they'll tell you, go and take coughing, tutulin, and all those things. Sometimes, yes, it's normal. When you take those things, it suppresses and all that. But when you see that these things are more than this particular days that the doctor will tell you, I'm not in position to say that the doctor, you're supposed to visit the hospital, check what's actually happening or what's actually going on. But you find out that these days a lot of persons are actually doing self-medication, treating what's not there, or they are not treating what they're supposed to be treating.
Thank you, Mr. Jeff. Thank you. Nurse Jeff, actually. Thank you. And my co-host, you were telling me before we started this show that even if you be doctor, if you find a permanent cure for this thing.
Which time did they?
You tell me, you talk like that again. You tell me this thing, rest. You tell me before we start.
Okay.
So now, if you were the doctor now, what would you have done? Or not to give the question to Oman?
No, actually, I know the bacteria, everybody has been talking about it. It's kind of an infection of the throats and maybe the upper respiratory tracts and all of that. So I was just wondering if just sore throats, like with my own understanding, like if I have sore throats, is it going to be a threat to me? Like, should I be scared that normal sore throat could develop to this diphtheria or something. I really do not understand what it is yet. So, how do you expect me to get a cure for what I don't know? Please, you pursue it.
I'm smiling because you speak so well right now. I'm amazed. I'm amazed. All right, so Dr. Omar, please let us hear from you what these challenges seems like to body.
All right, thank you for your question. But I understand you want to know if a person having sulfur, if you are having sulfurs, now should you be thinking, I have the
Should I be scared? Should I be nervous that something is going to go wrong?
Yes, I'll answer that question, but I just want to make a key clarification. This diphtheria we are seeing now, it's not a pandemic. It's just an outbreak.
Outbreak pandemic.
Yes, a diphtheria outbreak. So it's not a diphtheria pandemic.
Is it when it is now an inbreak that's not be a pandemic?
No, a pandemic has to have the disease has to have occurred all over. Yes, a layman just make easy. They have to have reported the outbreak really in other continents and has to have attracted major international concerns. Just for the layman, just to explain that. So that's what a pandemic would mean in the case of the COVID-19 pandemic. Do you get? So this diphtheria infection now is an outbreak because it's just a few cases, that has been reported in 80 states as at this time. So, to answer your question, if I have sore throats, should I be thinking I have diphtheria? Usually, you would not. So, diphtheria causes sore throats, but not all sore throats are caused by diphtheria.
Okay.
Do you get it? So, for the purpose of the times we are in, if you're having sore throats, if you fall for high index of suspicion, what do we mean when we say high index of suspicion? Meaning, until proven otherwise, you should just take all the necessary precautions and say that, okay, I might have diphtheria because this is what is happening at this point in time. And what happens when you feel that way? The first thing you should do is to report to your medical doctor.
So, yeah.
Nigerians have a poor health seeking behavior. 90% of persons, this need over generalizing now, but 90% of persons, once they have any symptoms, the first thing they do is they self-medicate. They'll go to their neighbor, bros, I beg, if you give me that medicine where they give it to you, the way you take 3 sore throats, all those kind of things. They won't get to their children, pass to their loved ones. It's not supposed to be so. In a saner climate, once you have symptoms like this, you best present to your doctor. You don't even go to the pharmacist because it's only the doctor that is authorized to prescribe medications for you. Then the pharmacist has to dispense.
Yeah.
Yes, so that first of all, when you have a sore throat or you have any symptoms of diphtheria, like Nurse Jeff has said, symptoms of diphtheria, they have sore throats, they're having fever, then difficulty in breathing, difficulty in swallowing, you should just quickly report to the nearest hospital. And worthy of note also is that diphtheria is a vaccine preventable disease.
What does that mean?
Vaccine preventable meaning there are vaccines that are available that can be given to you and boost your immunity and prevents you from falling ill to that diphtheria disease. So it is included in the Nigerian immunization schedule, and it's supposed to be given to children from birth. There are vaccines. There are vaccines that should be given to children up till about 14 years now?
Okay, yeah.
14 years. So the vaccine to prevent diphtheria is a vaccine that has already been made available right from birth to be given to the children. So the fact that it is still a recurring illness now means that there is a loop and there's a problem somewhere in the
Foundation.
in the uptake, in the taking of the vaccines. So yes, that.
All right, so I would like to add to what she said. I actually introduced the awareness and she spoke on it. So I also want to say a little thing in concerning your question. Can you say something like, if you're having sore throat, does that mean you have a tear? Or should you be scared? I know that. Firstly, will I say you should be scared? No, until it is confirmed that you have diphtheria. You don't need to be scared. I don't know if you understand me. You don't need to be scared until it is confirmed that you have diphtheria. But first, I think what you should do as a person, you should go to the hospital. There are tests. They carry out tests on these things. Like they can actually test your throat to see what's causing that sore throat. I don't know if you understand. So when you do that, the result will tell if you have it or not. So firstly, if you are having the symptoms of, you should visit them. Don't do self-medication. What we're basically doing is we're actually speaking and creating this awareness of people to stop doing self-medication. Stop doing self-medication. Don't have these things and feel like, I will just take this. Yes, it works, but it might not continue like that. I don't know if you understand it. It might not continue. So it is best you have the symptoms, go to the hospital, let it check you to see what's actually wrong with you. So until it is confirmed that you have the terror, no need for alarm.
Okay, there's one more question I want to ask. I remember you said diphtheria is not a pandemic, but it's an outbreak. Oh yeah? During the COVID-19 pandemic, they said if somebody that is infected near you, as you name it like this, sharply don't collect her. So this outbreak, is it also specific for pandemic or for outbreak or specific illness?
Like when someone else scared, like when person get diphtheria now, like only person will get whether it will affect you.
Yes, so yes, you can actually. You can near the person. No, we should learn. No, what we're trying to say is that like we said, we first mentioned that it's a respiratory tract infection. So it means that when you talk, when you breathe, you're passing it out.
You say kiss get papa, you don't collect her.
Yes.
To clarify, the mode of transmission is different from where you are first time, whether it's a pandemic or an epidemic. Mode of transmission now means how do you give it to the next? One person has it, how does it spread? That does it transfer to other people? So it's an upper respiratory tract infection. Yes, he has said that already. It is the mode of transmission it can be through respiratory droplets, coughing, sneezing, I don't know, whatever. So you just inhale inside the Then it can also be transferred through sharing of personal
effects.
Why should you be sharing brush with your friends?
No, I'm just saying, like, bro. Brush.
Yeah, we're going to that area. The thing is that I think we forgot to mention that it's not just sneezing, coughing, and it's also sweating. One of the symptoms is rashes. Like you notice some certain funny rashes on your skin, please report to the hospital immediately. You may say mosquito bites, massive reports. No, we're not saying mosquito bite. We're saying there's some rashes on irritation. You just see it and you just know that this thing is not actually normal. So please report to the hospital so let them check you out. Run a test. The thing is that a lot of persons are actually scared of going to the hospital. I think that's one thing.
How much is that test? The test now, how much?
I can't say because it's not in my field to say that, but I would advise you go to the hospital.
Because it may happen that somebody is scared that he or she may have been infected. May not, if you never get like 3K, 5K
Nigeria, that's what I'm saying.
Malaria test. How many people
Present day Nigeria,
self description.
You don't even have. You might not really have that money to spare for tests. No, I'm just saying. No, I'm not saying it's the right.
The money you used to do tests. I have
you don't wear.
You don't wear.
Should we understand?
Okay. At the end of the day, after you spend that money on self-medication and you don't get what because
not that medication.
Yes. It's people that used to do it because normally when you buy that drug, you're supposed to get well, but because we did not come to the hospital, so I think there's something going on.
These medical people,
Relax. Okay, so see, let me say something. The thing is that there's this thing about Africans that was
Come to me directly.
Africans are very strong.
The thing is that Africans are, maybe let's say, I would not want to use some word because we're on here. We like the hard way.
Hard way.
Hard way.
Life is hard now.
No, so that only sense that we know the right thing to do, but we prefer doing it our own way. And sometimes our own way is not the right way.
Our way is not the right way.
And sometimes it is not.
In that sometimes we're predicting.
Sometimes
Just take
it's-
it and it
See, the
works.
thing is that yes, there are some certain things that you should not joke with. One, health. Certain things you should not joke with. Life is one. You don't have another one.
Duplicate, huh?
So if you joke with it and anything happens to you, you'll be held responsible.
You'll be held responsible.
After you die.
Held responsible. Like wherever you find yourself, hell or heaven.
Oh, that side.
Yeah, so you will be held
Yeah,
responsible. Of,
See,
you should
spiritual
have.
mental smart and now
No, it's
spiritual.
not spiritual. See the point I'm driving at. We hate going to the hospital, and then a very bad way. No, it's not like you hate. Don't hate it. When you notice any change in your system, please do well to visit the seek medical attention. Don't do self-medication. That's what it says. I would not want to spill some things because we're here. That's what has brought, would I say, Africans, Nigerians to where it is right now.
That's
Do you know
true.
the
I
funny
not agree. I
and
not agree
that's
with that.
true.
I not agree
Do you know
with
it's
that.
funny and it's sad?
agree.
There are other
That money,
controversial
that
things. I have
agree.
done that. Not only this one.
That
agree
money
with
you
you.
don't
How
want
better
to
for health
spend.
matter.
That money you don't want to spend that you want to send medicate, or that time you feel you don't have what you want to send medicate, you don't want to go to the hospital because it takes so much time. I don't have money for this. I don't want to do that. When it gets to that critical point, that money will fall out.
How?
At that point where your health is already on the line, and you could have prevented it way earlier when you actually have good health, it can be when it presents when it is end, because that's when it can help it. It might get to a point when you get to that critical point, I'm saying, that you might have that money. You bring the money, you say all the time, Lord, the money you are chasing outside, the business you feel that will not let you go to the hospital, whatever. You have your whole time to give, you have the money to stay, but it might already be too late. So the earlier you present for health issues and get them sorted out, the better for you, the better for your family and your loved ones, like the stress. That's my
All right, so in essence, what we're trying to say, so we don't stretch or
Overflow.
bounce up. In essence, what we're trying to say is that don't see the hospital as a threat. Don't see it as a threat. They're actually telling you, discussing about your health. It's not about politics or something. So let's not go that way. You understand? So it's good, at least as a person, once in 3 months, know about your health. You understand? Know about your health.
Once in 3 months.
Once in 3 months, know about your health. Do a general checkup on your health. No, the thing is that some persons are also still scared of what the doctor will say. That's another thing. Some persons will tell you, I rather not know than know. Where I've seen a lot of cases like that, whereby someone will have a particular illness and live with it for a particular time because he or she is not aware. But the moment you tell the person,
It brings them
that
immediately.
cause depression and all that. So one reason why people are scared to visit the hospital is that, but still on steam, please, you need to know, because there are some things that if you start treating it early, there will be results, good results at some point. But for example, now you have this diphtheria and outbreak now, and yes, get vaccines. Do you understand? Get the vaccine. If you're taking the vaccine, that does not stop you from doing some certain things. For
Sorry, is the vaccine free?
yes, it's free.
It's free.
Very free. If anybody, I'm saying it on live now, well, everybody is listening to me. If anybody is charging you for the vaccine, please report.
Charge them to court.
Report.
Who charge you for vaccine? Charge them to
Report
court.
that things. It's
Still
free.
relies free.
Yes.
Any
I'm in my lines era.
Not hospital, healthcare centers, not in the hospital, healthcare centers, yeah, not in your hospital. Like this local governments we are right now. The local government has health center. So go to your local government health center and you get passe.
Okay. What about people that they are not Benins, they are not Edos? Does it apply? Like, can I just walk to any place and just tell them
In
one?
Benin, as far as we're in Benin, the thing is that it not happen in Lagos, neither in Abuja. And we have other persons who are not from Benin that are in Benin.
That's also
So as far as we're in Benin, you need to get vaccinated there. So go there and
So you could walk to any healthcare
Yes.
center and just tell them you want to
Yes,
get
the
that
vaccine is already there. It's just for you to tell them this is the vaccine you are coming to take, and you get the vaccine.
Okay. You medical practitioner have said you've given us a lot of information. I have two things to clarify before we start wrapping up. Now, the first being that you all have mentioned that when you are vaccinated as a child, as a baby, you mentioned between 0 to 14 years old, I still remember that you are kind of prevented, like you are sure you don't guard yourself against this outbreak as it stands now. So what about somebody who was not vaccinated as a child
All right. Okay.
and they are now victim of this outbreak now, of this illness? The thing is, so sorry, before, some persons are receiving treatment right now. Some persons that have not started receiving treatment, that have
persons do not
not
even
contracted the
that
disease, for
this
example, how will they now prevent it? We are saying vaccination. Should it not be the same dose that you're supposed to give to a child that you should give to an adult?
I'll speak
Or what are the things around it?
lead you, and I will let her do the.
Oh, time will sharp.
Yes, I'll let her do the, because I know she's in a better place to get on this.
That's
First,
a better place.
first I would say, now note this: even with the vaccine, you can still contact the terror.
Okay.
Note that the vaccine is not a shield.
They should.
It's not a Superman shield that, or what the Captain American shield that, when you are vaccinated.
So you cannot be doing sweat. It's not. Don't even care anymore.
No, the vaccine is just to prevent. You also prevent for example, if it's better off you have the vaccine in your system, and comes with damages of, or what the bacteria would have done to your system will not be as bad as when you do not have it at all.
What about somebody like me that have a very strong immune system?
And what's the vaccine? What's the vaccine doing in the system? The vaccine is to help your immune. It's an immune booster to boost your immune.
Glucose boost.
And okay, you're not with me here. I will not argue with you on that. So in essence, what I'm trying to say is that even with the vaccine, keys up, you ensure that you put in these things. First of all, avoid crowded places. Don't just go to some places and just people. Avoid crowded places and make sure you're using your hand sanitizer. And make sure you are covering your mouth when you are sneezing. Some persons don't know when to cover their mouth or how to do it. Some persons can just be talking like that. I don't know if you understand me. So we need to get it clear that even with the vaccine, you still need to do these things.
Okay.
You need to work on the environment. Make sure your environment is clean. Some persons live in a very dirty environment. I can tell you for a fact. Personal hygiene. How fun or how well do you brush your teeth, take your bath, change your, I don't know if you understand. I don't want to go into that.
I don't understand.
Personal hygiene. I mean, like your clothes you're wearing, like
Okay.
how clean it is. Some persons can put on a inner singlet for about 4 to 6, 7 days. You understand? So with that, you are endangering yourself. Even with the vaccine, you can still. It's possible.
That's fine. So we'll ask Omar Taye Asama. There was one boy I saw online. I don't know if it was false information. I don't know if it was true. He was spreading information that in UBTH here, this is our UBTH. He said ground off full. Say people are on the ground, they are lying down, no bed space for them. That diphtheria is killing people. I saw that video, even me come begin to fear. I saw people who also shared this video. So is that information true? I don't know. You said it's an outbreak, it's not a pandemic. So since it is an outbreak, not yet a pandemic, it means it does not pose enough danger for it to be declared as a pandemic. So is it true that people are in UBTH lying down on the ground, no bed space because of diphtheria? I bet let us know. Because people that are watching, they're also afraid. So that if they carry their mind come down, may their mind go ground. If they carry their mind go up, may they begin to fear. So I bet tell us.
Well, that video, it's the video circulating online about diphtheria, about
One boy.
in
That boy is
UCH being full people on the ground because of diphtheria. I cannot confirm that to be true.
Yes.
I cannot confirm that to be true. UBCH is a federal hospital, it's a teaching hospital. People from all over come there. So most of the time, it's always full. Our case is coming areas. It's UBTH. Should I say fully booked now? Okay, yes, there are lots of patients in UBCH, but those patients are coming in or are trooping in because of diphtheria. I can't confirm that to be sure.
Okay.
And the issue with it being an outbreak, and the reason why I said it's an outbreak, diphtheria, we've established that it's a vaccine preventable disease. According to the Nigerian immunization schedule, all children that are born should get vaccinated. Diphtheria is part of like the pentavalent. I think
pentavalent,
10 weeks and
6 months.
14
Yeah, 14 weeks, yes.
14 weeks. So that would say that majority of persons in Benin or in Nigeria should ideally be immunized already, than already have that diphtheria vaccine. But like you said, sometimes it is not like 100% effective and the immunity might wane over time. So that's why there are booster doses that are provided now, that have been provided by the Edo State government there. So as Nurse Jeff has said, if you feel like you were not vaccinated before or you are not so sure of your immunity, you can go for a booster dose at the healthcare center closest to you. So this diphtheria is more damaging to children under 5 that probably that were not vaccinated at all or that have not completed their vaccination schedule, then immunocompromised individuals. It shouldn't pose much threat. And that's why, as they've been saying diphtheria for the past how many months, people are not there dropping dead on top because there's a high vaccination immunity in the population because most persons are like vaccinated against that diphtheria. So they are aware now, yes. Not that they are aware now. Some person might even be vaccinated, but they will not know. But like I said, it's part of the Nigerian immunization schedule already. So as children, you should have gotten that. At this point, they can go get booster doses.
Yes.
Okay. Sorry. Those booster doses right now. Booster doses, right? Okay. These ones are not for diphtherias. Like, can you just boost your immune? There are some supplements that do
Of course.
immune boosting, not because of diphtheria or anything.
Normally, sorry, let me just come in because of time. Normally, as a person, we're supposed to boost your immune. Like before the podcast, I was having some conversations with the host and team and all that, and we spoke about how Nigerians hate to eat food. They hate it. They don't like you see someone, the person is not like thinking of, okay, Monday to Sunday, I've not had any of the foods, like 1 or 2. Now we're saying supplements. Some persons say, oh, supplements are expensive. Of course, we agree. But what about the mango? What about the watermelon? What about the banana? What about the cucumber? That's a very important fruit. People don't think it's important. What about those things? It's affordable. Some persons would rather spend eating fufu money afternoon evening.
Present day Nigeria now. So we just have to keep fit.
Yes, keep fit and forgetting to build your. See, the thing is that, like I said earlier, I said some persons might have these symptoms of diphtheria, and they won't know. I don't know if you understand me. They might have had it, and they won't know because of their immune. The thing is basically build your immune. Do you understand? So minus diphtheria or no diphtheria,
You should
build
build
your immune. It helps a lot.
And those immune boosters, are they also at the healthcare centers? Like, can we
Yes,
get
of course. We can't tell you a particular one to take right now because we are not authorized to do that. But seek medical attention. Meet your doctors or with someone who is in charge of your health. Let them run check on you and advise you on the kind of booster you take?
But we would always say before immune booster, I am assuming that by immune booster, you mean supplement, drugs, right? Like he has established. First things first to build your immunity, eat well, eat fruits,
Eat fruit.
eat vegetables.
Vegetables.
I understand the current situation of Nigeria. This is well expensive, yeah. Yeah, things are expensive. So some person might be like, you just say eat fruits, but that still remains the best way. When you incorporate fruits and vegetables into your diet,
Yeah.
it is way better for you for your immune
Those are
system.
it.
And then we have a funny way of eating vegetables. Try to eat leafy greens and they don't overcook and kill your vegetables.
Yes.
Because that's also another thing. You might say, okay, I'm eating vegetables, maybe I'm pulling sick or I'm having this symptom or the other. But you're not supposed to boil the vegetable for a long time. You've already killed all the nutrients. The nutrients supposed to give it to boost your immunity. It has been killed. So that's
Okay, if you want to incorporate vegetables to our meal, maybe I'm making a egusi soup now. So when I'm almost dropping it and I put it, the nutrients is still there. Because me, I want to start now. And I don't want to do lettuce.
vegetable is the last thing. When you
Not to
Why
me,
you- why you
I'm sure-
put
I'm
it-
sure class.
I was about to say that.
Booster
I was about to say that.
This is not bring you.
Booster
Say,
first
wait,
now,
leave.
Abi. What's your ugu?
Ah, God,
No,
I'm about to say
that's
that.
women.
For like
Booster
booster
is
is
expensive.
expensive.
We're trying to aim for
Okay, so
Wait,
see,
it should be crunchy.
note this.
Okay.
Note this. Now, all we are saying is that try your best to at least eat well. The thing is that you find out that the persons that actually stay more healthy, they are those that lives in village.
I won't even
And
argue
then when I leave
that.
LD people, no matter how
I'm
when I
going
leave
somewhere.
back, see,
somewhere.
we don't have time. Look at it.
Why?
So make I also back to village.
No,
I am not going. No, I am not
I
going.
understand. For real.
See my point.
They are fresh
Because why? Anything they are making
It's fresh.
is fresh, and whatever they are
Direct source.
direct, exactly, and they are also using the vegetables. How many times have you how many times did you eat vegetables last week?
I ate vegetables yesterday.
Yesterday, yes.
Before yesterday.
Before
When
yesterday.
last?
When last?
I don't remember.
Like I am frequent with
Now,
veggies.
because if you go to some eateries, and I'm also saying, thank God we're here. I also want to say this, please. Those eateries that are making life difficult for human beings, please. I think I would be like say state government should look to it. I don't know why you go to an eatery and you are buying swallow and they tell you you are ought to buy the vegetable soup also.
Leave that there.
That's Daniel.
See, let me just tell you. For
Hey,
real.
this is not a kitchen.
No, for real.
This is not a kitchen show.
We're not joking.
I know it's not a kitchen show.
Back to our
So we don't have time. We don't have time, but we have time in Jesus' name.
Amen.
So,
We have time. We are still
so you all were coming to this studio this afternoon. I see nurse carry soup come. You not tell us what you have to do. So nurse, why when I am what is supposed to do with it?
Alright, so thank you. I think this is to
Have you had to
actually
this?
no,
you
it's not
okay,
to
yeah?
cook. It's not to cook. Now this is actually to wash your hands. It stands for it's actually supposed to also to sanitize your hand. You can actually use it to
I
sanitize.
say this soap gets sanitizing properties.
I can't tell for this product. Okay, I can't tell for this product. But what I can say is that it's actually for that purpose, but I can't tell for this product. So I will tell you that after your daily activities, during your daily activities, it is ideal that wash your hand. Because of the environment we live in, some people fly buses for public places, markets, banks, and all that. After those waka, please do go to wash your hand. Some persons don't wash their hands and they just see food, shook their hand. If
You really like it about
soon and start eating.
Say that one start.
I don't know
wow.
if you understand it, so please wash your hand. I can't tell if this one actually has the sanitizer inside. I can't tell because I've not actually used this product before. But he says antibacterial hand wash. So please note that there's a difference between hand wash and hand sanitizer. Please don't mistake the both. This one is actually a hand wash. So I'm not advertising this product. So it says hand wash, antibacterial. So this is for washing. Wash your hand. Then the sanitizer is to sanitize your hands.
Okay. Thank you, Mos Jeff and public health advocates.
Oh my.
And Mataye Asama. And Asema, no mandatory. Co-host, Gusi Lord.
And Kennedy does say something for which was actually want to say thank you to the organizers of this podcast for actually creating something like this.
Edo Gifted.
Edo Gifted
100.
for that person. Thank you so much. And also I want to also use this medium to plead and also say this to the public in general, that please do well to live in a clean environment. I mean, these things are what we tell people, minus the whole hygiene. Yes, keep your environment clean, take personal hygiene seriously, and also avoid crowded places, and don't just touch some things unnecessarily. Don't just go and be doing oversabi touching and all that. And make sure that you are in the
Healthy environment.
healthy environment and all that, because see, the thing is that if you live healthy, you would not actually be part of or even participate in whatever is happening right now. So,
Okay, Jeff has advised you all.
Live healthy.
Doctor in prospects, Asama, has advised you all. One advice she gave you, in case you forgot, she said incorporate vegetables into your diet so you will not diet. You should understand that, right? Go.
But I also want to urge the general public to take advantage of the vaccine that have been provided.
yeah,
You can boost your immunity and all that, but since this diphtheria, it's a highly transmissible disease. If you are not vaccinated against it, you still have a high chance of coming down with this. So please, this propaganda of vaccines want to kill you, they want to do one thing or the other. Or
I used to hide and better.
That's
please,
For real.
take one thing, do away with vaccine hesitancy. The vaccines are there to make sure you do a good and have a good life. I know falls ill to this ill and sicknesses. So please be vaccinated today. Tell your neighbors, your friends, your sisters, those that are giving birth, those that are not. Do not be afraid to take the vaccine.
it's free. It's free. I was saying it's free because it's actually free. Report to whosoever is charging you for the vaccine.
Thank you very much, viewers. Thank you for joining
We
me on
love
this
you.
episode.
Thank
We're going to see you on the next one. And until then, keep staying healthy.